Hi everybody. I wanted to make this video to discuss a recent diagnosis I was given, and I thought it'd be a good idea to not only discuss it but actually document the process that I'm going through and what I'm feeling, not just emotionally but physically as well, and the tests I'm going to be going through, the procedures I might go through, and I also thought, it's good to kind of share what I'm going through in case others may be going through something similar. And it's also good just to feel like you're not alone. So hopefully it helps someone else out there. The diagnosis I was given was a blood cancer called Polycythemia Vera. I had never heard of it before I was diagnosed, and I doubt a lot of people have. It's fairly uncommon, and most people aren't diagnosed until they're in their 60s. Or later, although you can be diagnosed at any age, and currently I'm 49. So I thought I'd start by backing up a bit and talking about what led up to my diagnosis, what I was experiencing at the time. So it started about around the middle of 2016. I finally went to my doctor after experiencing a lot of hip pain and leg pain. And I was also very fatigued and had low energy, low mood. So I thought I better go and see what's going on. By that point, the pain in my legs and my hips was significantly impacting my life, my quality of life, and just my daily functioning. So the pain started probably just after I started my 40s. And initially it was mild. And it was occasional pain. So, for instance, I'd get up from the couch and I'd start walking and I'd have twinge of pain in my legs. And then it would resolve itself as I would move around a bit more. The other thing I noticed too was the muscle strength in my legs was decreasing. So if I'd be in the grocery store, for example, and I'd bend down to pick something up off a bottom shelf or something, I couldn't get back up without grabbing hold of something to pull me up. And eventually the pain, it kept progressing and progressing. And then it eventually included my knees and my feet, the bridge of my feet, my ankles. And it was in both sides. It was bilateral. So finally went to the doctor in 2016, and he ordered some pretty standard blood work. And he also checked my thyroid and my iron levels, B12, and I think some other kind of standard panels. And then he didn't order any tests to do with arthritis, though, or inflammation or anything like that, which kind of looking back I found strange, because that was my main complaint going to him, was the pain that I was feeling. However, he did go ahead and examine my joints and my muscle strength, and he concluded that it was IT band syndrome. Now, I'd never heard of IT band syndrome before then, so I kind of went home and did some reading about it. And the more I read, I started to doubt that diagnosis, because from everything I could read, IT band syndrome seemed to be more the result of an overuse injury. So something you might see in athletes or runners, and I was certainly neither of those. So I wasn't so sure about that. He did recommend I go to physical therapy, so I did try that. I went to physical therapy for a while, but I really didn't find that it was helping that much. It felt good when I was there and they were stretching out my muscles and stuff like that, but it didn't give me any long-term kind of relief. And while I was doing that, he did get the blood results back, and he called me in to discuss them, and my iron was very, very low. It was less than 5, and it wasn't even reading. My B12 was also low, and my thyroid stimulating hormone was high, which means my thyroid was underactive. So I had hypothyroidism. So at that point, he went ahead and ordered more tests to look for antibodies, autoimmune thyroid antibodies, and sure enough, I was positive. So that meant that I had a autoimmune disease called Hashimoto's thyroiditis. That's not uncommon. I think a lot of people have autoimmune diseases in this day and age, and hypothyroidism is probably one of the most common. So he went ahead and put me on thyroid hormone replacement, iron supplements, and B12 shots. And while he was talking to me, we were discussing the anemia and why I was so anemic. It wasn't a result of my diet, because I was getting iron in my diet. I do eat meat, not a vegetarian. Not that vegetarians don't get iron, but I was getting plenty of iron in my diet. And so the result, or the reason I was anemic, was to do with my menstrual cycles. So my menstrual cycles were extremely heavy and painful. I would get a lot of lower back pain and pressure. So, but the bleeding was the main thing that was a concern. So he went ahead and referred me on for a procedure called an endometrial ablation. And I went ahead and had that done in October of 2016. So that stopped my menstrual cycle immediately. So between that and taking the iron pills, the goal was, of course, to relieve the anemia and hopefully see some improvement in my iron and my red blood cell count. And sure enough, my iron did go up. It did improve. It didn't improve a lot, but it did go up. I was now within the low end of the range. And the other thing I should mention about my blood work when it came back was my white blood cell count was elevated. And he indicated that the reason for that was to do with my thyroid. So I just took his word for it. And over the course of several months, he would periodically order blood work to check my thyroid levels, because with the medication you're on, the thyroid replacement, they may have to tweak the dosage depending on your TSH level. So I would continue to go back to him every few months and have that done. In the meantime, for my leg and hip pain, the physical therapy wasn't doing anything really. So he did run some more tests at that point, and he checked for lupus, and he checked for rheumatoid arthritis, and he checked my inflammation markers, and all of those came back negative. So it didn't appear to be anything like that. So he went ahead and referred me on to a rheumatologist for further assessment. So I saw the rheumatologist, I think, in March of 2017. And that appointment, it was basically, I was only in there for about 15 minutes. And he asked me some pretty standard questions, symptoms, that kind of thing. And then he did a tender point exam where they press on certain tender points. And he went ahead and diagnosed me with fibromyalgia. It sounds like I don't believe any diagnosis I get, but again, I like to kind of understand what I'm being told, obviously. And I went home and I was researching fibromyalgia, and I don't know, I didn't feel that was necessarily a concrete diagnosis. I mean, obviously, fibromyalgia, there's no lab test that they can do, or imaging test that's going to screen fibromyalgia. It's more a diagnosis of exclusion. That's my understanding. So you rule out all the other possibilities, and if you can't find anything else and it seems consistent with fibromyalgia, then that's what you're diagnosed with. But in my case, they didn't do any imaging studies. They didn't rule out a lot of other things that it could have been. So I was doubtful that that's what it was. But at that point, I mean, it's the diagnosis I was given. So he went ahead and said, you will be overseen by your regular doctor, your family doctor, and he'll oversee medication for fibromyalgia. So when I saw my doctor, he prescribed antidepressants, and antidepressants are used to treat fibromyalgia. And I think the one I was on was Cymbalta, and there was another one. And I tried those for probably 6 months or so, and I didn't find any relief in the pain, and the side effects were substantial. I'm all for taking medication if it's appropriate and if it's effective, and if the side effects are, the benefits outweigh the side effects. But in this case, the side effects were, like I said, they were substantial, and I wasn't getting any benefit. So I discontinued taking those. I didn't see the point in taking a medication that wasn't relieving my symptoms and was making me feel worse. So I'm still in pain, and it's chronic pain. It's getting worse, and like I said, it was spreading down into my knees and my lower legs and my feet. So by this point, I'm limping a lot. It is difficult just to do your basic everyday kind of, go to work, grocery shop, housework. It's really taking its toll on me. So he went ahead and referred me to a chronic pain clinic. And the chronic pain clinic doctor, he was really good. Like he took the time to listen to me, and I was explaining to him, I'm a little frustrated because I feel like I've not had enough tests or no imaging studies, and how can you treat someone when you don't know what's going on, and you haven't ruled everything out. So he agreed with me, and he went ahead and ordered some imaging studies. Unfortunately, they came back, well, I guess it's fortunate, they came back negative, but at the same time, I'm like, I still don't have an answer. And, I think he ordered, it was a spine X-ray, hips, and there was an ultrasound done on my hip. And like I said, nothing came back. So he had offered at that point that they could do steroid injections, I think, or nerve block injections. I declined it at that time. Although it was impacting my daily functioning, I could manage. Like, I was in pain, but it was almost like I was getting used to the pain. It was like my new normal. And I could still function, even though it was difficult. So I declined those. And then in the meantime, my regular doctor, like I said, he was continuing to perform blood work about every 3 months. So my most recent round of blood work in October of 2018 came back, and it showed that my red blood cell count now was high, and my hemoglobin and my hematocrit was high, and my white blood cell count is still high. And it always hovered around the top end of the range or over the top end of the range. But my red blood cell count, that was kind of unusual, because up until that point, like, I was anemic before, and with having the ablation and everything, it started to go up, which was good, but now it was going over the top end of the range. So he called me in and we discussed it, and he said, I'm going to refer you on to the hematologist, because, it could be something, it could be nothing, but it could be something. So he said, I just want to make sure. So I said, that fine, that sounds good. So I went ahead, and in November I got a call from internal medicine at my local hospital, which was confusing to me because I thought I was seeing a hematologist. But the way it works in my area, the local hospital, the internal medicine clinic will run some initial tests, and then I guess if they came back negative, then they wouldn't bother referring me on. But if they found anything concerning, they would go ahead and refer me on to the hematologist at that point. So around the end of November, I saw them, and they ordered a couple of blood tests, and they also ordered an abdominal ultrasound. And the reason for the abdominal ultrasound was because they examined me, my spleen. They palpated my spleen. They felt around, and they thought it was a bit enlarged. So that was the reason for the abdominal ultrasound. And then the blood test that they ordered, the way they explained it to me was that these tests would help them distinguish if the reason for the high red blood cell count was for primary causes or if it was from secondary causes. So secondary causes would include things like dehydration, smoking, living at high altitude, and then primary causes would be blood cancer or some systemic disease process. So the two tests that they ordered were the JAK2 mutation test and an EPO test. And EPO stands for erythropoietin. So at that time, I didn't really know what the tests meant or what exactly they were for. And when I asked them, they just said, well, they're special tests. So at that point, I was a little put off. Like, what do you mean they're special tests? But later I understood why they said that. And the reason is the JAK2 test is a molecular test, genetic DNA. It looks at the DNA in your cells for a gene mutation. And not every lab is equipped to do that test. So they have to send it out in our area. They send it out to a different city. So that's what they meant by special test. And then the EPO test, the erythropoietin, if you have a high red blood cell count, they look at your EPO to see if the reason for that high red blood count is because you have a high EPO or a low EPO. The high EPO would indicate like your body is, EPO is the hormone that signals your body to make more red blood cells. So the kidneys secrete this hormone when it thinks you're running low on red blood cells and you need more. So if it's low, then there's another reason why you have high RBCs, red blood cell count. So I went ahead and had those tests done and the abdominal ultrasound, and then they called me back. Or we set up an appointment to go over them January 2nd of this year, 2019. So I went in January, and there was a different doctor at that time, and he proceeded to tell me that my ultrasound came back fine. They did not find anything significant, so I guess my spleen wasn't enlarged. But he said, you did test positive for this JAK2 mutation. So I had about a month's time in between those two appointments from November 29th to January 2nd to kind of research and Google everything I could. And if you Google a positive JAK2 mutation test, you're going to see results pop up for blood cancers called myeloproliferative neoplasms. And in one of those particular MPNs, there is one called Polycythemia Vera, which is what I was diagnosed with. 95% of people with PV they test positive for this JAK2 gene mutation. So, and they have typically a low EPO. And when I asked him what my EPO was, he said it was low normal. So I knew at that point kind of where we were heading in terms of a diagnosis. So I asked him, okay, well, what now? And he said, well, we are going to refer you on to hematology. And you'll see them, and they'll discuss, any further testing, treatment, and so on. So I met with the hematologist February 5th. Today's February 16th. So it was only a couple of weeks ago. And my husband came with me. we met the doctor, and she was wonderful. I had a really good feeling with her. She's very young, which I love actually, because I just, I don't know, the doctors up until that point that I had experienced personally, they were on the more experienced side, and not to knock experienced doctors. I'm sure there's plenty of wonderful experienced doctors, but it was just refreshing to have someone who was on the younger side. And I thought, you know, if you're going to be diagnosed with something like this, you want someone who's in the know, who's really kind of engaged in all the scientific research that's out there, that's aware, that's going to take the time and really invest in your care. And she was great. Like I said, she was thorough. She took the time to kind of explain to my husband and I what it meant to be positive for this JAK2 mutation. Even though I had done my research and I kind of knew what she was talking about, like I knew everything that she was saying, it was really reassuring to have her take that time and go through that with me. She also felt around my lymph nodes to see if I had any swollen lymph nodes in my, you know, around here and in my armpits and stuff like that, which I didn't. We talked a little bit about my pain that I had been experiencing, and she didn't seem to think that that was related, but she was concerned, and she recommended I see a rheumatologist again. She's going to put in a referral for a different rheumatologist. So she swears by this guy. She said he's really good. So I probably won't see him for a matter of months because he's pretty booked. But I really appreciated that as well. That it, you know, she was looking at the whole patient and all of my symptoms, even if they didn't seem connected to Polycythemia Vera, that, you know, she still was vested in my overall care. So she indicated that the next steps are to order a bone marrow biopsy. So I'm having that done on February the 25th. And I'm certainly not looking forward to that. Most people aren't. It's not the most pleasant of procedures, not that many of them are, but this one is, you know, somewhat invasive. I'm glad she ordered it though, because, you know, my understanding is not all hematologists do. A lot of them will just go based on the positive JAK2 mutation test and your blood counts and symptoms. However, she explained to me, being on the younger side of this disease, even though I'm 49, I don't consider that young, but because most people aren't diagnosed until they're older, the fact that I'm diagnosed on the younger side, it's good to establish a baseline, so where we're at in the disease. And it is a disease of the bone marrow. It's a cancer of the bone marrow. So having that test now allows her to track any progression of the disease, because it is a chronic progressive blood cancer, and it could eventually transform into acute myeloid leukemia, or it could progress into one of the other MPNs. And there's two other main ones, essential thrombocythemia, which your platelets are high, and myelofibrosis is when you start to develop scar tissue in your bone marrow to the point where eventually your bone marrow will stop making blood cells, and then your spleen has to take over that job. So with Polycythemia Vera, being on the younger side, again, she wanted to get that baseline. And the other reason for ordering the bone marrow biopsy is it allows her to rule out any other potential blood diseases or leukemia. So I am, like I said, I'm going for that on February 25th. And then treatment. She talked about treatment, and again, being on the younger side of the disease and early in the diagnosis, We start off with one daily low-dose aspirin per day. And the reason for that is obviously if your red blood cell count is high, your hematocrit's high, your hemoglobin's elevated, that means your blood is thicker. So aspirin helps to thin your blood. And we all know that, thicker blood doesn't flow as well. And if your blood isn't flowing as well, you are at risk of having a thrombotic event, blood clot, deep vein thrombosis, or a heart attack, stroke. So I started the low-dose daily aspirin, and then the other thing is to start having phlebotomies. And phlebotomies are the removal of blood. So you go to the lab, they remove blood, and you may have to have that done several times over the period of time. So that's kind of the next steps and where I'm at. And, it's been a lot to kind of take in. I wasn't expecting this kind of diagnosis. I'm still in a lot of pain. Haven't gotten to the bottom of that yet. And I really don't know. I'm hoping that the bone marrow biopsy doesn't turn up anything else, and because I'm just kind of now it's now sinking in that I have PV. So hopefully they don't find anything else. But if they do, I guess we'll just go in another direction. But anyway, it's kind of been a curveball to say the least, and I don't know. I think that, what can you do? When you're given this kind of news, you do your best to just try and kind of learn as much as you can, research as much as you can, make sure that you have a good doctor, and just try and stay on the positive side, right? I mean, there's not much else you can do. And you just trudge on. Life goes on. So anyway, I'll probably do another video when I go through those tests and just talk about what that was like, and on from there. All right, take care.